Four good things that will never happen in American healthcare, because good things in American healthcare would piss the neoliberals off. Good thing number one that will never happen in American healthcare. Stop collecting all that data and running all those studies. Let other countries do the studies on healthcare. They do a better job of it. American healthcare studies are a gigantic scam. They are often funded by big pharma or device manufacturers, and they are run through universities that charge big bucks and bill back overhead to the U.S. government. American healthcare studies are like the Pentagon of the 21st century: bloated, wasteful, irrelevant, harmful. Most of the studies don't benefit anyone, except perhaps for the big corporations that buy them and the people who run the studies. The studies corrupt the researchers who rely on them to fund their careers. The big companies pay consulting fees to doctors and researchers to hopelessly and forever compromise the science, which would be laughable if it wasn't disgusting. Which means that the science, medical, academic, pharmaceutical study complex has gone a long way toward destroying American trust in medicine and science. So you can just imagine how much of a money trough getting rid of all those studies would shut off. The yells of enraged funding withdrawal would echo through halls of giant faceless buildings across the nation. The threats, the warnings, the bitter diatribes. It would be the worst thing ever to happen to Americans, ever. At least that's what you would hear. Nevertheless, let other countries do the science. Sad to say, they do a better job of it these days. Good thing number two that will never happen in American healthcare. Set an actual budget for spending. Boy, the United States spends about 18% of GDP on healthcare, which is way more than other nations spend. Nations that do a better job on, healthcare. So we could cut that back to, let's say, 14% of GDP, which is still a lot more than many nations, but it's doable. So here's what you would hear if the Americans cut back their healthcare spending to 14% of GDP and strove for the better outcomes that other countries achieve. You would hear, oh my God, oh my God, oh my God, oh my God, that's such a big reduction in healthcare spending. We're all going to die. That would come from the vertically integrated for-profit insurance screaming about death. And the death they are talking about, they don't mean you're going to die. They mean their executive bonuses are going to die. The horror. So this is obviously never going to happen, but a good thing would be for the United States to do an actual realistic, I know, funny, assessment of its American healthcare capabilities and the time and the resources spent on them. This assessment would discover that the U.S. healthcare system is a giant patchwork of insanity. Expensive insanity that should, in an ideal world, just go the fuck away, which would entail things like changing hospital spending in the U.S. because hospitals in the U.S. are outrageously expensive. How expensive? Like charging $1.50 for a Tylenol that costs 1.5 cents. So charging 10 times what the pill costs. But sometimes hospitals mark up their goods and services by up to 1,000%. So one big, fat, important way to drive down hospital costs in the U.S. is to get rid of the fragmentation of the American healthcare system. which means getting rid of all those for-profit insurance companies and the different government entities that get involved in running hospitals and the never-ending expense of billing and collections and driving Americans into bankruptcy and all the shit that goes with that. In fact, you would do better to just get rid of for-profit hospitals altogether. That would get private equity out of the picture. And if we get private equity out of the picture, we've saved a shit ton of money already. Not 4% of US GDP yet, but a shit ton. And after hospitals become nonprofit, they can stop charging on a fee-for-service basis, which means they don't charge you by the Tylenol and for the big, expensive, unnecessary robotic surgery that they make most of their money on these days. So here's what you would hear if we started to do that. Oh my fucking God, you can't do that. Everyone is gonna die. By which private equity and insurers and executives and for-profit hospitals mean their executive bonuses would die. They would say, oh, that's socialized medicine. How can idiots and assholes become supremely wealthy if you have cost-effective hospitals? Maybe they can't. Good thing that will never happen in American healthcare. Number 3, get rid of wasteful, unnecessary, overpriced, ineffective services. So the United States annually spends about $1 trillion a year on what have been deemed unnecessary, overpriced, wasteful, and ineffective services. $1 trillion. 20% of U.S. healthcare services fall into this category. You could get U.S. healthcare spending down closer to the norm for developed countries if you just got rid of the waste. The waste, the gravy train, the fraud, the unnecessary, the overpriced, and the ineffective. Getting rid of waste in American healthcare would require a culture shift so profound that it would be like rays of heavenly light bursting through the storm clouds of American greed. It would be apocalyptic. It would be like making goodness great again. It would be like destroying neoliberalism. It would be like a miracle. Good thing that will never happen in American healthcare. Number 4. Stop pushing for longer lives and start pushing for better ones. You may have noticed some influential and wealthy Americans have a longevity fetish. Maybe they're afraid to die because they've heard rumors of hell and they think, oh shit, I'm a really good candidate for that. Maybe not. But the US and the rest of the world is jam-fucking-packed with really old people these days. What does really old mean in this context? It means over 85. Some people over 85 have really good quality of life, but lots don't. American healthcare ensures that people linger after debilitating strokes, after heart failure, after kidney disease, after diabetes, after L3, after L4. Alzheimer's and other forms of dementia take people in slow motion. Elderly people often grind out their days with most elements of their personalities and lives eroded, disappeared, forgotten, invisible. The drugs and the surgeries work miracles. Miracles of life extension. Miracles of prolonged suffering. Years. Decades. With everyone afraid to let go, no matter the cost. And the costs can be very, very high. For everyone. For the elderly. For their families. For society. For the facilities that house the slowly dying and the underpaid health aides that struggle to care for them. The motivations for endlessly delaying death may be noble. The realities are cruel, costly, and not inevitable. Other countries do things differently. That may be a scary idea, but things that reduce the cruel and the horrifying are worth looking at. Most of us alive today are going to see more than enough cruelty and horror. We don't need to spend our last days on Earth wallowing in either.